I can't imagine the situation that some people have found themselves in. When you've lost your job, you have to stay home. You're dealing with the anxiety of making ends meet, not being able to see friends, family. Um, there are crisis helplines out there. The county crisis hotline is 1-800-724-0461. And then there's a secondary number of 877-426-4373. And then there's actually a text line as well, which is 716-392-0252. And people, there are real struggles out there right now. And the overdose numbers that I've seen, I just got a report from my narcotics investigator, former chief of Fredonia Police, Brad Myers, and when we're at 40 since the New York pause began, and that's 40's overdoses, not necessarily death. I believe it's at least six. It may be more than that. I'd have to get the final OD map numbers, but that's up. That's up a lot from compared to last year, and all those trends were moving in the right direction. That's the reason we had Christine Schuyler, our director of the Department of Health and Human Services, on our call today, just to kind of bounce some ideas back and forth of what can we do. One of the ideas pitched was potentially setting up a place where people can get Narcan. I mean, we're to that point where we're trying to distribute Narcan. I mean, we just, there's a real fear that people, especially as this drags on longer, are going to resort to using narcotics to kind of assuage their mental health problems, and the risk of overdose is greater right now than it probably has been in quite some time.
And we do know that several law enforcement agencies now do carry Narcan as they respond to places,
Yeah.
to try to help people. But I think important to note is if someone is having an overdose on whatever substance, there is a law in New York, if you can talk about that, that
Mhm.
protects those who would call for help.
Yeah, the Good Samaritan law. I want to say there was a press release put out yesterday by the sheriff, Christine Schuyler, and Chief Snelling. But essentially, what that Good Samaritan law is if you're calling 911 for assistance for someone who's overdosed, if you were using with them, you aren't going to be arrested for drug possession or paraphernalia possession. And the idea behind that law, and it was crafted quite some time ago, the idea behind that law was to promote people to call for help. So if you find yourself in a situation, an unfortunate situation where someone who you're with has overdosed and you're worried about finding yourself in trouble, that Good Samaritan law protects you. If you call 911 and authorities have to respond to help the person overdosing, that law is going to absolve you from responsibility. Now, that being said, we have a partnership with the U.S. Attorney's Office where, if we come across an overdose death, which we are continuing to investigate every single one, we are looking for the dealers who are selling these drugs to find them, turn their cases over to the U.S. Attorney's Office, because the mandatory minimums on selling drugs that result in a death is a 20-year mandatory minimum. And we are looking at these cases when someone is overdosing and dying, and we are looking to package these cases up and send them to the U.S. Attorney's Office. Now, that Good Samaritan law will protect the person who's with the person who's overdosed, and it won't protect the drug dealer who's out selling drugs on the street to these folks, leading to their overdoses. So I do want the public to know we continue to look at these cases in an effort and in our partnership with this U.S. Attorney's Office.